Now, the Health Secretary, Jeremy Hunt, has apologised to patients after hospitals were told to delay tens of thousands of non-urgent operations and outpatient appointments in England this month, so the health service can cope with the winter pressures. The Prime Minister acknowledged the decision was disappointing and frustrating for all those affected, but she insisted that the NHS was better prepared for this winter than ever before. Many senior doctors, though, have warned that they're struggling to cope. Labour says the NHS is in crisis. Here's our health editor, Hugh Pym.
Cancelled operations bring new worries for patients like Anna. She's due to have facial reconstruction surgery after nerve damage. There's an outpatient appointment next week, but that's in doubt, and her hopes of the operation happening in January seem likely to be dashed.
It's kind of impacting my life quite a bit. I mean, I drool quite a lot now, which is quite frustrating. And, you know, and I am very uncomfortable, really, with it. And I think it will improve my quality of life quite a lot to have it.
Today, the Health Secretary, Jeremy Hunt, pushed for explanations, said sorry to those patients who were affected.
I want to apologise for the fact that we have had, regrettably, to postpone a number of operations. We're trying to do it differently this year. Last year we cancelled a lot of operations at the very last minute, so people got a call the day before to say their operation wasn't going ahead. That is obviously very undesirable, so we want to do it in a much more planned way.
Surely the NHS can't be running properly under your government if you have to cancel a month's worth of operations and outpatients appointments.
Well, I think it's important to recognise that these pressures are pressures that we're seeing all over the United Kingdom, in Scotland and Wales, where the NHS is being run by different political parties.
The Prime Minister said she recognised that for people who'd had their operations postponed, it was disappointing and frustrating. She said NHS staff were doing a fantastic job. NHS England and the government say extensive preparations for winter were carried out across the system. But if that's the case, the question is, why were official instructions on cancelling non-urgent operations extended this week? Here at St Mary's Hospital in West London, they've planned to treat more people without needing overnight stays. The idea is to keep beds free for those who really need them. But it's been tougher than they expected because patients this year are sicker than they were.
The numbers are largely the same, but the intensity of the illnesses we've been seeing this year actually is very, very significant. And we've really had to work very hard to find appropriate places to nurse patients who've got really very serious conditions. And I think a number of things play into this. The weather, as we know, we're beginning to see an increase in the number of flu cases, and all of that builds up to quite a problem for us on some days.
Throughout the day, there were reports across the country of the highest level of stress at hospitals. Nottingham's Queen's Medical Centre asked patients to avoid A&E because of sheer weight of numbers. Southend and Plymouth were also said to be under extreme pressure.
When you've got ambulances backed up outside hospitals, you've got hospitals saying they're overcrowded, when you've got people waiting on trolleys for hours and hours and hours, it is a crisis, and it's because of 7 years of underfunding and cuts to our NHS and the government simply burying their head in the sand.
NHS Scotland said there'd been a 20% increase in A&E visits before Christmas. The Lanarkshire Health Board has for now cancelled non-urgent procedures. The Welsh Government said thousands of hours had been lost for ambulance crews waiting to hand over patients at hospitals. It's early in the new year and the NHS across the UK is already struggling, and it's patients who are enduring the consequences. Hugh Pym, BBC News.
Well, Nigel Edwards is Chief Executive at the Nuffield Trust, an independent health think tank, and he gave me his response to the postponement of so many non-urgent operations.
It looks like the sort of problem we have every year. It looks a little bit worse than perhaps we're used to. Elective operations are cancelled every year. It's not a great way of running a health system in the sense that the people who do elective surgery are not necessarily any help in treating the types of emergency cases we see. But I can't think you can have something that happens every year and call it a crisis. But it does show just how hot the health service is run and how little space there is to accommodate big peaks in demand.
So is the problem then in the planning for this once-a-year occurrence? Is that the issue that we've got here? Because it seems as if the Health Secretary and the NHS, Department for Health, they're damned if they do and they're damned if they don't. Last year, they cancelled a lot of appointments late on. That upset a lot of people. Now they're postponing things for a month. They can't win.
if you're going to cancel, it's probably better to cancel a month ahead rather than on the day before.
So things have actually got better then.
You know, I
in
think the real issue is that the variability in demand for healthcare does mean that you will get these big spikes. You can sometimes in some of these hospitals see almost twice the number of patients that you see on an average day. So and planning for that is really difficult. It's not always easy to predict it. But I think what this perpetual problem we have every single year for probably as long as I can remember shows that we're trying to really run the NHS too close to the margin of what is actually safe and sensible. There's not enough spare capacity and flex in the system, and so the staff who are exposed to this, particularly during the winter months, getting burnt out. These are very tough jobs to do. I think giving people a little bit more respite and having a little bit more flex in the system would mean that it would be able to accommodate some of this growth that we see in demand during the winter months without having to cancel operations.